สวัสดีท่านผู้ชมทุกท่านนะครับตอนนี้อยู่ผมกูสเอ็กซ์ทีวีนั่นเองครับตอนนี้ก็มาอยู่กับเกมเดิมเช่นเดิมนะครับเรียงกันเลยครับกับอยู่กับการทำอะไรไม่รู้ครับรูทแคนอลเซอร์เกลเวตช่างแม่ครับรีบเล่นเถอะ
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and Before we begin, would you like to review some? In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on. Let's give our patient a few minutes to relax, for their mouth to become completely numb.
รอ5 นาทีรอเป็นชั่วโมงเลยไอ้สัตว์แน่
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth. Once the rubber dam is in place, put on a tooth clamp to keep it from moving. Next, we'll need to dry out the tooth as much as possible using our air water syringe. So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill. The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot. At this point, the dentist would measure the depth of the canal using a combination of X-rays and specialized equipment. If a dentist fails to measure properly, it could mean that Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha. Looking good. A heated instrument is now used to remove the excess gutta percha. Pack the gutta percha into the tooth canal using a plugger. After the gutta percha has been placed, it is common that additional X-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on surgerysquad.com. After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen